Assalamualaikum and hi everyone. In today's video, me and my other group member will present about uterine cancer, where this disease is the second highest cancer among women in Malaysia. Without wasting any time, let's get started.
Many uterine cancer is uterine cancer the most common cancer in the female reproductive system. It is a malignant tumor that starts from cells of the uterine organ. Malignant tumor can grow at rapid rate, destroying nerve tissue. It also separate or metastasis to another organ or another uterine organ. Causes uterine cancer is the disease. Cancer is a disease that is out of control for cells in the body. The body part where it starts, even it's related to another part of the body, still named for cancer. Uterine cancer is called uterine cancer when cancer begins in the cervix. It is bounded the upper part of the uterus by the vaginal progeny. The womb or fetus is when a baby is pregnant.
There are 7 signs of uterine cancer. First is light or blood spot before or after the cycle. And 2, menstrual bleeding, longer and more serious than normal. And 3, bleeding, showering or vaginal examination following intercourse. 4, enhanced drainage of the vagina. And 5 is pain in the course of sex. 6, during menopause damage. And 7 is when you have back pain recurrent. Uterine cancer stage. There have 5 stages in this uterine cancer, which is start from 0 until number 4. Okay, stage 0, cancer is found only in the cell of the surface of the cervix. And next is stage number 1, which is cancer invades the cervix further. In stage 2, the cancer has started to spread around the cervix. And stage 3, the cancer has spread to the pelvic. And stage 4, cancer has spread to other organs of the body. How do you diagnose uterine cancer? They have 3 steps to diagnose this uterine cancer, which is number 1, by performing the PAP test, number 2, by doing a colposcopy test, and number 3, by performing the biopsy test. So what is meant by these 3 tests?
So now I will continue the presentation on how do we diagnose uterine cancer. Uterine cancer can be diagnosed with several tests mentioned earlier. Alright, so I will start with the PAP test first. What is a PAP test? PAP test is to examine the cells taken from the cervix. It is used to detect changes in cervical cells that indicate cervical cancer. This test can find out if you have cervical cells or abnormal unhealthy cancer cells. Next, do all women need a PAP test? This question is repeatedly got asking from all the women. The answer is no. If you are a virgin or have never had penetrating sex, it is recommended for women aged 21 and over, or women under the age of 21 but active in terms of sexual activity for 3 years or more. Before doing this test, the doctor will explain it on how is it performed. Once you are lying on the examination table, the doctor will place a device called a speculum into your vagina. The speculum will stretch the vagina wall until it opens, so that the doctor can examine the vagina and cervical parts more clearly. The doctor then will use a special brush and cotton bud to remove some of the cells from inside and around the cervix. The cells are placed on glass slides and sent to the laboratory for examination. Result can be obtained in at least 2 weeks. If the PAP test produces abnormal results, the doctor will recommend further tests such as colposcopy and biopsy. Apart from the PAP test, you can do a colposcopy. Colposcopy will be done if your PAP test is not at a normal range. It can examine the cervix in more detail to identify abnormal cell sources. To avoid inaccurate test results, individuals should avoid the use of tampon and have sex for 24 hours before the test is performed. The last test that can be performed is a biopsy. A biopsy test is performed if an abnormal part is detected during a colposcopy test. Small fragments of abnormal tissue will be taken from the cervix. This tissue will be examined with a microscope in the laboratory to identify this abnormal cell type. Next, and this is the last point that I should explain in this presentation, which is uterine cancer risk factors. There are many factors that can be among the risks of developing uterine cancer. Changes in the balance of female hormones can be one of risk factors. Female ovaries produce two main hormones, namely estrogen and progesterone. Changes in this hormonal balance can cause changes in the uterus. Menstruation at an early age, especially before the age of 12, or menopause at the end of age, increases the risk of uterine cancer. The longer menstruation you experience, the longer your uterus is exposed to estrogen. Also, for women who have never been pregnant, have a higher risk of uterine cancer than women who have at least one pregnancy. Do not think that an older age have a minor percentage to suffer from this disease, because even in an older age, the risk of uterine cancer also increases. Uterine cancer often occurs in women who have reached menopause. Healthy lifestyle care also affects in order to prevent any disease. This is because obesity is included as one of the risk factors. Being overweight increases the risk of uterine cancer due to the ability of excess body fat to change the hormonal balance in your body.
That's all from me and the end of our group presentation. On behalf of group members, thank you very much, and we hope what we present today can increase the knowledge and awareness to all women out there about this uterine cancer to immediately do the test mentioned earlier as a first step for prevention.